Hey, welcome back to Momentum. Now, that was Britney Spears, of course, with Oops, I Did It Again. And right now, we are on Health on TRAXX. You're currently listening to me, KG, and today we will be talking to Dr. Thiruchelvam Mathiarasu, who's the medical officer with the Vector-Borne Disease Control Unit with the Perak State Health Department. Good morning and welcome to the show, Dr. Thiruchelvam.
Good morning, KG.
Hi, how are you today?
I'm fine. How about you?
I'm doing quite well. And how's the weather like in Ipoh?
Well, it's fine here in Ipoh.
All right, lovely to hear that. And of course, today we're going to be talking about World Malaria Day 2022. Now, of course, the word malaria has been, quite common, especially in many different countries. Not as common as like dengue is in Malaysia, but let's talk about malaria first, right? Now, today is World Malaria Day 2022. Now, Doctor, please do educate us on what exactly is malaria.
See, malaria is an acute febrile illness, and this is caused by Plasmodium parasites.
Mm-hmm.
And usually, currently, we have got 5 common Plasmodium parasites which cause malaria disease in humans. So it's Falciparum, Vivax, Ovale, Malaria, and Nolosi. These are 5 common malaria plasmodiums which cause disease in humans.
Mm-hmm.
And as you can see, this particular disease is an acute febrile illness. Usually people will have a high-grade fever associated with sweating and chills.
Mm-hmm.
And people commonly also have headache, body ache, malaise, could have jaundice, anemia, and if they are not treated early, they could get into complications. They get coma, they can get organ failures,
Mm-hmm.
and they could even die from this disease.
Mm-hmm.
As you mentioned earlier, this disease is currently not common in Malaysia,
Yeah.
but back in the day, in the 60s and 70s, this was a major disease in Malaysia.
Major health risk.
Yeah, from statistics from Ministry of Health shows that we had about 250,000 cases during that time.
Wow.
So as you can see, currently we have got dengue as a vector-borne disease, which is the most prevalent
Mm-hmm.
disease in Malaysia currently. But the burden of malaria in the 60s, 70s was greater than what we have dengue currently.
Mm-hmm.
And, people who actually went to seek treatment in the 70s or 80s, when you have fever, when you go to the hospital or clinic, malaria is a common test being done. They'll actually poke your finger and take some blood and make a slide and test you for malaria. That's actually a very common practice back then.
Mm-hmm.
So anyhow, our vector control disease division was primarily formed in the 60s and 70s to combat malaria.
Oh, okay.
And, and eventually our unit is now taking over, we're doing dengue commonly now.
Mm-hmm.
But actually the unit was actually formed to combat malaria back in the day.
And you've succeeded quite well.
Yeah, this has actually been a very successful program for us in Ministry of Health.
Mm-hmm.
As you can see, back in the 60s we had a malaria control program and we managed to bring down the cases to a certain level.
Mm-hmm.
And since 2011, we have been doing malaria elimination program.
Completely eliminating it from our society.
Yeah. So what happened is the program has also been very successful.
Mm-hmm.
And for the past 4 years, we have had 0 indigenous human malaria cases.
Oh, wow.
So which means we don't have any local human malaria transmission in Malaysia for the past 4 years.
Wow, okay.
But unfortunately, we do have zoonotic malaria,
Uh-huh.
which is caused by Plasmodium nolosi.
Okay.
So this zoonotic malaria is a problem currently for us.
Mm-hmm.
We are reporting about 2,000 to 3,000 of nolosi cases per year in Malaysia. But of course, 2,000 to 3,000 seems to be a small number, but this particular disease can be fatal. That's the problem.
Mm-hmm. Now, when you say zoonotic, what does that actually mean?
Okay, zoonotic means this is a disease spread from animals to humans.
Oh, okay, all right. So
in
essentially,
this particular scenario for zoonotic malaria, the host is macacas,
Oh, okay.
And they usually live in the jungle or the fringes of,
The forest and
forest side.
yeah.
And when our people go and have contact with this, when they go to the forest or when they go to the tourism or anything, so they probably can get infected with malaria, especially in our side.
Mm-hmm. All right. Now, of course, you've mentioned the zoonotic spread right there. And how can malaria spread? The most common ways it can.
All right. Okay. Malaria as like dengue, is actually a vector-borne disease.
Mm-hmm.
It is caused by mosquito bites. And in this particular disease, the mosquito which spreads them is called Anopheles.
Okay.
So Anopheles is the mosquito which spreads the disease. Mm-hmm. So when the mosquito bites an infected person, and when you get the parasites go into the mosquito,
mm-hmm.
and subsequently this particular mosquito will bite a healthy person, and the parasite can enter the healthy person, and after a period of 1 week or 2 weeks, and they actually develop symptoms of the disease.
Mm-hmm.
And if it is a zoonotic malaria, it's not from another person, it's from the macaca,
mm-hmm.
and the mosquito bites the macaca, and then subsequently when there are human around there, and they bite the human,
mm-hmm.
and we get the disease as well. So this is the main mode of transmission of this particular disease. Mm-hmm. But of course, this disease can be also transmitted through, blood transfusion,
mm-hmm.
and those kind of mother to child.
Mm-hmm.
But these are very rare.
Yes, of course.
But yeah.
And how about waterborne or airborne transmission?
No,
Is that possible?
it doesn't get transmitted to air or waterborne. It is we need to have the vector-borne. The mosquito has to bite
mm-hmm.
and transmit the disease.
Okay.
Or of course, when you already have the disease in you, and it can be spread through blood transfusion, because
mm-hmm.
of course, the infected parasite can be transfused to another person,
mm-hmm.
or they can also be transmitted from mother to child. But these are very, very rare circumstances.
And especially in Malaysia, even more
yes.
rare, right?
Even blood transfusion also is very rare, because all the blood which are being donated has to be screened for infectious disease before being transfused to another person.
Yes,
so
absolutely.
It's very, very rare that these things happen, but it is reported.
All right. Now, how is the common way of detecting a malaria infection, doctor?
All right. It is currently the gold standard for malaria diagnosis is by using microscopic examination.
Mm-hmm.
So we would actually take a bit of blood and smear it into a slide,
mm-hmm.
and a trained technician will actually do a reading of the slide by microscopy,
mm-hmm.
and then they can determine it is malaria and what subspecies of malaria, and also they can make a count of the malaria present in that particular slide.
Oh, wow.
So this is
mm-hmm.
is the most common way that we do diagnosis, and this has been being done for since the beginning of malaria diagnosis.
Mm-hmm. I mean, after all, it's a parasite, right? You can definitely see
they can actually detect the parasite by slide, because its parasite is a big pig, so we can
mm-hmm.
be read by microscope.
Mm-hmm.
Unlike viruses and all, we can't do that by microscope.
Yeah, you would need an electron microscope to be able to see
Yeah,
those.
and it's not feasible. But
mm-hmm.
because this is usually using a common light microscope, which is available in all labs.
Mm-hmm. Right. That is wonderful, Doctor. Now, Doctor, we are going to be taking a small break. We're going to have a song, and once we come back, there's more that we want to talk to you about malaria, yeah?
All right, sure.
All right, Doctor, so just stay on the line. Right now, though, let's come back with some music. We are going to be back right after that to talk to Dr. Thiruchelvam Mathiarasu, who is the medical officer with the Vector-Borne Disease Control Unit at the Perak State Health Department, and today we are talking about World Malaria Day 2022. Right, Paramour's Misery Business right here on TRAXXfm, and we are talking to Dr. Thiruchelvam on Health on Tracks today. He's the medical officer with the Vector-Borne Disease Control Unit at the Perak State Health Department. We are talking about World Malaria Day 2022. Now, we already talked about what is malaria, how can it spread, and how do we detect. Now, Doctor, welcome back. And can we know what is the treatment for malaria?
All right. At this point of time, we have got a treatment. Actually, for malaria, we've got anti-malarial drugs.
Yes.
Unlike for dengue, where we don't have a medicine for it.
Mm-hmm.
For malaria, we have got very specific anti-malarial drugs for it.
Mm-hmm.
So currently, we have got some good medications, and commonly we can give it by oral if the disease is not severe.
Mm-hmm.
And if the disease is severe, we can administer an IV intravenous drug. So these drugs are available in all healthcare facilities as hospitals and selected health clinics. It should be available in all the private facilities as well. So currently, drugs are very good. If the detection is early, we expect 100% cure rate.
Okay. Wow.
So this is quite good, the drug currently. So it's just that sometimes we have people coming in very late.
Yeah.
And when they come in with multiple complications, and even though we give them the anti-malarial drugs, patients sometimes succumb to the disease because of the complications.
The other complications that can be caused by malaria itself.
Yeah, we could actually give the drug and clear the body of the parasite. We can kill the parasite off. But the complications which has already been done, damage done, couldn't be reversed.
Yes, of course. Now, can the malaria drugs also be taken as a precaution? Say, for instance, that you're going to be traveling to a country that has prevalent cases. Can taking the malaria drugs pre-hand be good?
There are medications available that can be taken for prophylactic. So there are certain drugs that are available in the market, and people can consume the drug before traveling or conducting any risk activities. So there are about 3 or 4 different medications currently available, and you have to take according to the prescription.
Oh, it's a prescription base.
Yeah, it's a prescription base. It's not like a single dose kind of thing. You have to take a couple of days earlier or even weeks earlier, and then during the activities and then post. So it's a bit not a one dose settled kind of a thing. You have to follow the regime.
Yeah.
And a lot of people, they don't take according to regime, so it becomes useless if you don't really follow the guide,
Yeah, it's just like antibiotics.
Yeah, it's like antibiotics. But it is a chemoprophylactic drug. It doesn't mean that once you take it, you are free from, you'll be 100% protected.
Oh, okay.
You still may have a risk of getting the disease, but,
it's much lower.
Yeah, not necessarily, but it's not really 100% protection. You can't say, if you take this prophylactic, you will not get malaria. No, not necessarily like that.
Just as a precaution, then you would say.
Yeah.
But the drugs that's used to treat malaria, once you get it, now those are 100% guarantee unless the person who comes in is already under much more severe complications.
Yeah. At this point of time, our drugs are quite good, and we do have, we can say that 100% cure rate is possible.
That is absolutely amazing news. Now, of course, doctor, I do need to ask, who is at risk of getting a malaria infection?
Okay, for now, we have got 2 different types of malaria, as I mentioned, human malaria and zoonotic malaria. So the human malaria component we have actually eliminated in Malaysia, but it is still a risk because the mosquito is, is present in Malaysia, especially in the vector. And it's just that if anybody from maybe foreigners, per se, if they come into Malaysia with the disease, they can actually transmit the disease and spread the disease locally. So for the human malaria, the risk is actually, the areas where there are presence of foreigners, risk group, these people may transmit the disease. And foreigners usually are in, the estates, the plantation,
the fringes,
and this, in the logging industry. So these areas, where the mosquito is present and the potential of foreigners who can be potential carriers of the parasite. So there are people who are going there, they could probably get the disease. And of course, those of our locals who actually work abroad or travel abroad. A lot of Malaysians, they actually work in foreign countries. They work in countries where malaria is a very serious disease, like Africa or Indonesia or Papua New Guinea. A lot of Malaysians, they go there, they work in the industries and plantation sectors. Then they come back with the disease.
Yes.
So these are people at risk. And for zoonotic malaria, as I mentioned, this disease occurs in the jungles or fringes of the jungle. So those people who actually forage into the jungle. Some people actually work in the jungle, they can get the disease. Some people actually, like nowadays, ecotourism is a thing.
Yeah.
So a lot of people actually go into the forest and they go for ecotourism. So these are people who are potential they could get the disease.
Yes.
Currently, in Perak, I'm from Perak. So for the past few years, we've been actually getting a lot of zoonotic malaria cases reported among durian farmers.
Durian farmers, yeah.
Yeah, because, durian is a fruit.
Uh-huh.
The macacas, the monkeys, they probably like the fruit probably, and they actually go into that area. And our fellas also go into the
jungle,
the jungle, or not the plantation,
the
durian plantation,
yeah.
and which are actually located in almost like a jungle kind of a area, out, urban, not
rural area,
rural areas. So they get infected there. And this particular mosquito, Anopheles, it actually bites. Preference is to bite in the evening, at night time. And sometimes, so when these people are waiting for the durian at night, they are at risk of getting infected. And we also get a lot of cases among ecotourism people who come and, they want to enjoy the nature, but they get infected in malaria.
So this can, I just want to just double back to the zoonotic thing, right? So this can happen if the monkeys actually bite the humans.
No, it is still a vector-borne disease.
Oh, okay.
It actually based on the mosquito has to bite the monkey.
And then bite you.
And then transmit the disease from the monkey to us. It's not by the monkey by itself doesn't transmit the disease.
Okay, now that was the only part that I was confused about. Thank you for clearing that up, Doctor.
Yeah.
Now, of course, let's talk about the malaria current situation in Malaysia, and I think we've touched on quite a bit of that, but I would love for you to explain a little bit more.
So currently, as I mentioned earlier, we are free from local human malaria transmission since 4 years already. And this is going to be the 5th year running that we are going to be free from malaria, human malaria. So basically, the target is achieved, and we are awaiting for formal auditing by WHO for certification of malaria free.
Wow.
So that is something which ministry is working on, and we probably will go for an assessment and certification. Certification. So things has been delayed due to the COVID pandemic because of the WHO couldn't come down for assessment. So that's something in maybe this year or next year that ministry probably will be doing for. But unfortunately, we still have problems with zoonotic malaria. And we are working, trying to get on top of it. But that's the thing, because these are infections which are occurring in the jungle and the forest fringes. We don't have a proper control measures. Like unlike human malaria, we know the disease actually infection occurs indoors. The mosquito, the indoor infection, human to human. So we do some control activities targeted on this particular disease, and whatever activities that we have done actually very successful in reducing the malaria burden in Malaysia and subsequently coming up to zero local transmission.
Okay.
So which means very successful for human malaria transmission. But when it comes to zoonotic malaria, we don't have a control measure in place to tackle outdoor forest transmission,
All right.
So that's the thing. So we could only advise the public to take precautionary measures when they are going into the jungle or when they are doing risky activities in malaria-prone areas. So we suggest that people should, utilize mosquito repellents when they are going into the jungle.
Yes, absolutely.
Yeah, and then they have to use the mosquito repellent according to the recommendation of the manufacturer. Not you can't just apply once and then think that it'll be effective for the whole day.
Yeah.
Some repellents you have to reapply every few hours.
Yeah, that's the thing.
Yeah, and then on top of it, we also recommend that you should wear long-sleeved clothes when you go into the jungle. When you have long-sleeved clothes, you have less surface or skin exposed that the mosquito will bite you.
Yep.
And of course, as we mentioned earlier, they could also take medication, chemoprophylaxis. And of course, once you are having fever or disease, please go to the nearest healthcare facilities for assessment.
Yes.
So, and then, if you have a history of travel to malaria-prone areas, please elicit that to your healthcare provider so that they can suspect malaria and do the, malaria test.
Yep.
Sometimes when you don't elicit this kind of history, people may not think about malaria.
Yes, because it's rare, and also the way of testing it is by putting your blood under a microscope,
Yes,
and that's
yes,
not
yes.
very common as well.
Yeah, it's quite common for us in the hospital and
Yes.
clinic settings. We do it, but sometimes we don't have that in the the GP setting lah.
Oh, right. Yes, understandable. Now, of course, Doctor, this year's World Malaria Day theme is to harness innovation to reduce the malaria disease burden and save lives. Well, then, what is your take on this?
Yeah, this is actually a global, slogan. You can see that this disease globally is actually a big problem.
It is.
Malaysia maybe is not so big. We have 2,000 to 3,000 zoonotic malaria cases per year, but overall for the world, according to the WHO's World Malaria Report 20 last year, they actually estimate that there are about 240 million malaria cases worldwide.
Wow, that's a huge number.
Yes, a huge number. And from that, they actually estimate that there are about more than 600,000 deaths due to malaria. And the majority of these cases and deaths are occurring in, poor African countries.
Yes.
So they have a lot of, difficulties there, in terms of medication, control. A lot of things are lacking there. So these are probably the target. They need a lot of innovation now. We need innovation in terms of, we need new tools for combating malaria globally.
Yes.
We need new medication. We need better vector control interventions. We need better diagnostic, maybe faster diagnosis. Microscopic thing can be done in the clinic setting. What about field testings?
Yes.
Those kind of things. So a lot of things that need to be worked into. So we actually require a lot of innovation.
Yeah.
So for all these components, so that all these things can be utilized in effectively to reduce the malaria disease burden and also save life. Yeah. And of course, as I mentioned, for zoonotic malaria, we have a problem. We don't have a proper, control measures for it.
Yes.
So what can we do with this? Our existing control activities are tailored for human malaria. What we do is we give mosquito nets, insecticide treated nets. We do larviciding. We do spraying.
Yes.
So these are all effective for human malaria, but for zoonotic malaria,
not
it's
so
not that
much
effective.
Yes.
So we also need a lot of innovation and research and studies and things to come up to target zoonotic malaria as well for Malaysia. So sometimes we do have some new techniques, but it has to be cost effective
at the same time
and feasible for us to utilize.
Yes.
So there's a lot of things that has to be looked into. That's why I think they have this theme for this year. Harness innovation to reduce malaria disease burden and save lives.
Yes, I think the testing needs to become even more streamlined, needs to become automated, maybe in like a litmus test or something. Just put the blood on a slide. You already know.
Those kind of thing. We do have some rapid tests can be done, but it's still not gold standard, or it's still subject to can be used as a screening, but not for diagnostic.
Yeah, so maybe we need a way that where like as long as we have humans within the fold, we still take a bit of time to be able to do it. You still have to visually check and everything. Maybe something AI driven. Hopefully in the next 10 years or so.
Yeah, hopefully we get some better things coming up from I mean the studies and things are going on worldwide. So a lot of things are shared among other countries and during national conferences and all. So we hope that we get something out of it lah.
All right, lovely, Doctor, lovely. Now, Doctor, before we end the interview, any other last words that you would like to add on for our listeners?
Yeah, I mean, as I mentioned earlier, at this point of time, in Malaysia per se, we have a problem with zoonotic malaria. So we like to emphasize that everybody has to take precautionary measures when they are actually going into malaria-prone areas, especially in Malaysia when you're going into jungle or jungle fringes. Do utilize insect repellents, wear long sleeve clothes, take chemoprophylaxis if it is available, and of course please go to the nearest healthcare facilities if you have fever once you have done any risky activities.
Yes, absolutely. Now, all right, Doctor, thank you so much for being with us, and thank you for being the voice of, the voice of controlling malaria right here in Malaysia as well. We hope you have a great time, and we hope to have you again in the future as soon as we need to talk about any other vector-borne diseases as well.
Okay, thank you.
You have a good day, Doctor. Bye-bye.
All right, have a good day too.
Right, so that was Dr. Thiruchelvam Mathiarasu, who's the medical officer with the Vector-Borne Disease Control Unit at the Perak State Health Department. We talked about World Malaria Day 2022. Now, although the disease is all but extinct in Malaysia, now we still have some cases of zoonotic-based transmission. So, guys, if you're going into the jungle, please be careful, alrighty? Right now, though, it is now time for more music on TRAXXfm.